Welcome to today's practical training video on the iTEC Level 4 Diploma in Advanced Aesthetic Treatments, and we are going to be focusing on Unit UBT 467, which is in providing superficial chemical peels. And in this video, we will go through everything that you need to know about carrying out a chemical peel treatment step by step. Now let's get to it. We are going to begin with how to actually set up your trolley for a chemical peel, and here you will find everything that you are going to need during your treatment. On the left, you have a list of all of the skincare products that you will need to have in your trolley. Now keep in mind that all clients have different skin concerns, so it will be entirely up to you to select the most suitable skincare products depending on your client's skin and needs. And then on the right, as you can see, you will find the list with all consumables that you would need to have ready and prepared on your trolley. Make sure that your trolley and your working area is set before the client arrives for the treatment. Once you have everything in place, then you can start the chemical peel. Now let's look into what the actual treatment steps involve. Here you can see the full treatment protocol step by step, and we are going to go through each individual step in this video. We do actually advise you to follow this treatment routine very strictly, as results can be compromised if products, equipment or techniques are altered or not included. Now let's have a look at the first steps of the chemical peel treatment. Before we actually go into the step-by-step protocol, we need to do a few things to ensure that the treatment runs smoothly. You need to begin with having a consultation with your client where you discuss what their skin concerns are. This helps you determine whether the client is suitable for the treatment and also what product you would need to use for their skin specifically. Next, you will need to check the client's consultation form for any medical history or any contraindications, as well as whether they have signed the form. If the client has no contraindications, then you can take a before photo of the treatment area, put on your gloves and place the headband onto the client. And now you're ready to begin the treatment. Have a look at the first step of the protocol. And we are going to begin with a thorough cleanse, which just ensures that there is no makeup, grime or bacteria on the skin before we go ahead with the next steps. For the cleansing routine, you have a choice of two cleansers. You have the Ageless, which is suitable for dry, aging and darker skin types, or the Clarify, which is suitable for the oilier, congested, acne-prone skin types. For this client, we actually chose the Ageless cleanser as her skin is quite dehydrated and dull. Take the cleanser you have chosen, use about 2 pumps and dispense it onto your fingertips. Emulsify the product between your fingertips and spread the cleanser starting from the décolletage, moving up to the neck, and lastly apply all across the face. Once the cleanser is on, you can start with the cleansing routine from the décolletage, only using circular movements and your fingertips. You move on upwards towards the face, starting from the chin area, and again, as you can see, we are using circular movements with the thumbs, then slowly moving up towards the jawline, working your way up towards the cheeks, and again, only using your fingertips. Then you are going to use 2 of your fingers on each hand to cleanse around the lip, going crisscross from left to the right. And from there, you are going to glide up towards the bridge of the nose, using circular movements on your fingertips and slowly coming up to the forehead. And once that's done, you will want to do 3 circular movements around the eyes, moving outwards, and finally finish off at the temples by applying a little bit of pressure. Once the cleansing is done, you are going to need 2 damp gauzes to completely remove everything off the skin. You're going to start from the décolletage, sliding from the right shoulder, moving to the left shoulder. And with the other hand, do exactly the same and slide from the left to the right, and repeat this until the cleanser is completely off. Once the décolletage is done, then you are going to move slowly up to the neck area, use gliding movements going upwards towards the face. And for the face, starting from the right side, one hand gliding up and then followed by the other. Slowly make your way up towards the cheek and then move on to the other side of the face, repeating the exact same process, one hand followed by the other. Once that is done, you are going to fold the gauzes into half and glide upwards, starting from the chin area, going up towards the mouth, the nose, and lastly finish off at the forehead. On the forehead, move both hands sideways towards the temples and finish off the cleansing routine by applying a little bit of pressure on the temples. If the client has lipstick on, you can carry out a lip cleanse. Apply 1 pump of the cleanser on a half cotton pad and spread that onto the other half cotton pad. Start cleansing from the right side, moving to the left. Move your hands simultaneously in both directions until the lipstick is completely off. For removing eye makeup, you need to apply 1 pump of the cleanser on a half cotton pad and start cleansing from the right eye. Stretch the eyebrow, place the cotton pad on the eye and move downwards to take off any eye makeup. Half the cotton pad and wipe underneath the lash line, moving inwards and then outwards. Then you can move on to the left eye and repeat the exact same process until all eye makeup has been completely removed. After the initial cleanse, we are going to move on to the next step, which is using the ultrasonic scrubber to deep cleanse the pores. To use this probe, you are going to click on the skin scrubber from the menu. Make sure that the probe is on mode 1, which is the deep cleansing mode, and then press on start. To activate the probe, you would need to press on the little grey button on the probe itself, and then it's ready to use. Before going ahead with the scrubber, you need to reapply the cleanser all over the face. Use 2 pumps of the cleanser, emulsify the product between your fingertips using a bit of water, and then apply it all over the face. Make sure that the skin is quite wet before going ahead with the probe. Before you begin, take 1 damp cotton pad in your hand and switch the probe on. Start from the right side of the face, from the chin area, using small, quick strokes, moving upwards towards the jawline. Once you have gone over the jawline, move higher up towards the cheeks and move towards the ears, repeating the same process. As you are actually doing this, you will see that there is going to be a residue on the probe spatula, so use the damp cotton pad in your other hand to wipe that off. Once the right side of the face is done, you can move on to the left side and repeat the exact same process. If at any stage you see that the skin is becoming dry, make sure that you do reapply water using your fingertips. The ultrasonic waves push the water into the pores, which clears out all of the congestion and impurities out of the skin. This is why you always need to make sure that the skin is wet, otherwise the scrubber will not actually be that effective. Once the cheeks are done, you are ready to move on to the forehead area. From the forehead, start in the middle and move the probe outwards towards the temples. When one side is done, then move on to the other side and repeat exactly the same. Once the forehead is done, move on to the nose area, and as this is a very small and intricate area, you can use the tip of the probe around the nostrils. Apply some pressure when using the probe to get rid of any congestion. And finally, you are going to move on to the chin area, and for this you need to ask your client to place their tongue under their lip. Move sideways and upwards with the scrubber using small strokes and applying pressure to deep cleanse the pores. Now that is done, we can move on to the next step. For this step, you are going to need the clarified peel mask, which is suitable for all skin types, and it has exfoliating, hydrating and brightening properties. Take a medium-sized glass dish and squeeze a pea-sized amount of the mask. When applying the mask, only use one finger to spread it on the skin. Start from the right side of the face, from the chin area, moving up towards the jawline and the cheeks, and once that is done, you can move on to the other side and spread the clarified peel mask evenly all across the face. Use the clarified peel mask straight after the ultrasonic scrubber to ensure that there is no residue after the deep cleanse, and the mask also helps draw out any impurities out of the skin, which actually prepares it for the chemical peel that we are going to use later on in our treatment. Once you've done the left side of the face, you can move on to applying the mask all across the forehead, nose, upper lip and the chin. Make sure that the mask is spread across the whole face evenly. Once the mask is completely on, you can use your fingertips to work the mask into the pores. Use very slow and gentle circular movements all around the face, allowing the mask to exfoliate the skin. Do this for about 3 minutes and then leave the mask on the skin for another 2 minutes before removing it. To remove the mask, you need to use 2 damp gauzes. Start from the right side, and as you can see, one hand is gliding up, being followed by the other. Slowly make your way up towards the cheek and then move on to the other side of the face and do the exact same process. Once that is done, you are going to fold the gauzes into half and glide upwards, starting from the chin area, going up towards the mouth, then the nose, and lastly the forehead. And in this step, you are going to prep and tone the skin for the chemical peel, and for this we actually have a choice of 2 prep solutions. As you can see, you have the Lumen Peel Lotion, and that's suitable for dry, aging skin and pigmentation concerns. And then we have the Clarified Toner, which is for the oilier, congested and acne-prone skin types. For this client, we went with the Lumen Peel Lotion as her skin is quite dull and also dehydrated. You need to dispense 3 pumps of the solution onto a damped cotton pad. Apply the solution using the cotton pad starting from the right side of the face near the chin area, moving upwards towards the jawline and making your way up to the cheek. Move on to the other side of the face and repeat exactly the same, starting from the chin and going up towards the jawline and the cheek. Once that's all done, go over the forehead, moving outwards towards the temples on each side. And then lastly, we're going to go over the nose, upper lip and finish off at the chin area. Once you've covered all areas, then you can move on to actually applying the chemical peel. Now for the chemical peel, you have a choice of 3 different peels which have all been formulated to treat specific skin concerns. Now for example, you have the Ageless TCA peel, which is for dry, dull, aging and sun damaged skin. Then you have the Clarified peel, that's for the oilier, congested and acne prone, blemish prone skin types. And then the Illumine peel, that's for darker skin tones and hyperpigmentation concerns. For this client, we chose to go with the Ageless TCA peel as her skin is quite dull with visible sun damage, also quite dehydrated as well. You need to use a full pipette of the chemical peel and place all of that into a small glass dish. Before applying the chemical peel on the skin, always make sure that you cover the client's eyes, and for this you can use 2 damp half cotton pads. Don't forget to do this step as this is a health and safety requirement for a chemical peel treatment. Dip the chemical peel brush into the glass dish and start applying it from the right side of the face from near the chin area, moving upwards towards the jawline. And as you can see, we're using quick, small strokes as this actually allows the chemical peel to go deeper into the pores. Move upwards towards the cheek, and once that side of the face is done, you can move on to the left side. And again, we're just repeating the same process, starting from the chin area, moving up to the jawline and then the cheek. Once that's done, we move on to the forehead, and you are going to start from the right side, moving the brush outwards, going towards the temples, and then repeating the same on the left side of the forehead. Finally, go over the nose, upper lip and the chin area. Once the chemical peel is on, you can remove the cotton pads from the client's eyes. Now you can move on to the next step, which is using the Revival Dermal Roller with the chemical peel. The dermal roller consists of 540 microneedles, which actually open up microchannels into the skin that allow the chemical peel to penetrate into the deeper layers of the skin and completely optimizes your results. In comparison to only topically applying the chemical peel, using it in combination with the dermal roller, the results are completely optimized and incredible. For this, you are going to need a 0.5mm dermal roller, Open up the packaging and take off the upper lid off the box. Place this on your trolley and you're ready to start. Use the dermal roller while the peel is still on the skin. Start from the right side of the face near the chin area, moving up towards the jawline, and as you can see, we're using very quick small strokes with the dermal roller. We're only applying a very little pressure and consistently changing our direction from horizontal to vertical. Changing your direction with the dermal roller actually allows you to open up a lot more microchannels into the skin, which then actually optimizes the penetration from the chemical peel. Once you have completed the right side of the face, you can move on to the left side and complete the exact same process. Once both cheeks have been done, you can move on to the forehead, and for this area make sure that you are not applying a lot of pressure as the skin is very thin. If at any stage while you're doing the dermal roller you see any blood specks, ease off with the pressure as you should not be seeing any blood at any stage during the treatment. Once that is done, move on to the nose, upper lip and chin area. Once you have covered all areas with the dermal roller, throw away the dermal roller away in a sharps bin, or alternatively put it back in its plastic container and give it to the client to use from home. Once the dermal roller is completed, you can move on to removing the chemical peel. For this you are going to use cold water, which removes and neutralizes the chemical peel and stops it from working. For this you're going to need one damp cotton pad. Starting from the right side of the face, moving upwards towards the jawline and the cheeks, moving on to the left side of the face. And lastly, going over the nose, forehead, upper lip until the chemical peel has been completely removed of the skin. Once the chemical peel is completely off, we're going to move on to the next step. For the next step, you're actually going to use one of the revival serums in combination with the no needle mesotherapy. Here you have a choice of 3 different serums which have all been formulated for the specific skin concerns, and as you can see we have the ageless HA serum, and that is specifically for dry aging skin. Then you have the clarify serum for the oily, congested, acne prone skin types, and lastly the Lumin serum, which is for the darker skin tones that have hyperpigmentation concerns. For this client we went with the ageless HA serum as she has quite dehydrated skin. Before going ahead with the serum, you will need to switch on the no needle mesotherapy probe. From the machine, select the no needle mesotherapy button from the menu, adjust the setting on 5 and press on the start button. And now you're ready to begin. Apply 3 drops of the serum on the right side of the face and spread it across evenly only using one finger. Place the probe on the skin and use slow circular movements starting from the chin area, and you're gonna make your way up towards the jawline and the cheeks. We actually use the ultrasound probe after the dermal roller as there are already microchannels that have been created from the manual device into the skin, and the ultrasound will actually optimize the penetration of all of the active ingredients that we're using. When you've completed the right side of the face, you can move on to the left side, and we're going to do the exact same process. We're applying 3 drops of the serum, spreading it across evenly just using one finger, and then again carrying out the no needle mesotherapy. The ultrasound probe actually has the ability to penetrate all the way down to the dermal layer of the skin, pushes the serum into the deeper layers of the skin. Once the left side of the face is done, repeat the exact same on the forehead, upper lip and chin. Once all areas have been covered, you're ready to move on to the next step. Next, you are going to use the ageless stem cell sheet mask, which is suitable for all skin types, and we will use it in combination with the LED light. Take the sheet mask and open it up gently from the top. Fold the packaging in half and squeeze out the solution inside a medium-sized glass dish and place the dish on your trolley. Take the mask out of the packaging and slowly place it on the client's skin, gently adjusting the corners of the mask. Once the sheet mask is on, place 2 halved cotton pads on the client's eyes and follow up with blackout goggles. You are going to need the blackout goggles for the LED light, and this is a health and safety requirement when you're doing the LED therapy. Now you are going to use the LED light on top of the sheet mask, and for this you need to switch the probe on from the machine. Select the LED photon light button from the menu, choose the type of light you need to use, adjust the intensity to 5 and then press on the start button. Place the 2 probes directly onto the skin and slowly glide sideways across the cheeks. Gently move your way up towards the forehead and the temples. For this client, we chose the red LED light as it's anti-aging and stimulates the production of collagen and elastin. You can also place each probe directly onto the skin and stay in one place for 30 seconds, allowing the light to actually penetrate into the skin. Carry out the LED therapy for about 5 minutes, and when you're done, gently remove the goggles, cotton pads and sheet mask, only using your fingertips. When the mask is completely off, if there is any residue from the sheet mask, use circular movements in your fingertips to very gently rub any solution that's left on top of the skin. And moving on to the next step, which is the massage, and that includes the chest area, neck and face, which should take about 7 minutes to do. Let's get to it. For this step, you are going to use the extra solution from the ageless sheet mask. You're going to place the solution onto your fingertips and apply it onto the skin, starting from the décolletage, moving up towards the neck and then the face. Once the solution is all across the skin, then you can begin your massage routine. Start off from the décolletage with both hands. We're using circular movements going in and outwards directions and slowly making your way around the shoulders. Then going across the back of the neck and applying a little bit of pressure. Move on to the shoulders. Place both hands underneath the client's shoulders and use your fingertips facing up, gently moving your fingertips and applying pressure, and this is a technique that's called knuckling. Slide upwards towards the forehead and gently slide down, only using 2 fingers without applying pressure. Use both hands to scoop up towards the forehead and then glide down, only using 2 fingers. Scoop up again, keep your right hand on the temple, and with your left hand slide to the right, down and then scoop up. Now keep the left hand on the temple, and then with your right hand slide left, down, and then scoop up. And you want to repeat this for 2 more times. Place your fingertips on the forehead and use gentle circular movements. Use your fingertips to go around both of the eyes, using circular movements and applying pressure at the temples as you go. Now do a figure of 8 around the eyes, only using one finger to go around both of the eyes. With your right hand, scoop up the right side of the face, followed by your left hand. And also use your fingertips to gently massage and scoop up. Move to the other side of the face and repeat the exact same process. Place your right hand on the right side of the face and scoop up, and then use your left hand with one finger to go around the mouth, up towards the nose and then forehead. Move on to the other side of the face and repeat the exact same process. Apply pressure to the temples and glide down to the earlobes. With your fingers, use circular movements to massage the earlobes. Once that is done, place your hands on the client's ears, and then your massage routine is complete. And for the last step of this treatment, you are going to apply the Illumine Moisturizer, which is the Revival Sunblock that also acts as a moisturizer as well as a sunblock and is suitable for all skin types. You need to dispense a pea-sized amount of the moisturizer onto your fingertips. Spread the product between your fingertips and apply it starting from the chin area, moving up towards the jawline and the cheeks, and lastly forehead and nose. Use gliding and circular movements to apply the sunblock evenly all across the face. And applying the sunblock is the last step of our treatment routine, and once that is done, remember to take an after photo of your client and remove the headband as well. Remember to give your client the aftercare advice. It is actually very important for them to know how to look after their skin after the treatment. You can recommend a suitable skincare regime for them based on the skin concerns and needs, and advise them on what the next treatment should be and also when. And that's everything you need to know about carrying out a chemical peel treatment.